If I take in my left hand, what happened? This greater facet looks medially, should be laterally. That is right patella. Well, bones of the leg and foot. What is this bone? Tibia. That is correct position. It is left tibia. It's like all tubular bones consist of proximal and distal epiphysis and diaphysis. Apophysis, here it is tuberositas tibia. Proximal epiphysis consists of two condyles. Here it is medial and this one is lateral. Condylus medialis and condylus lateralis. Between them, eminence, eminence intercondylaris. In front from this eminence, we have area intercondylaris anterior and posterior area intercondylaris posterior. Here it is superior articular surface, facies articularis superior. Facies articularis fibularis, that is place of attachment of fibula in lateral side of lateral condyle, facies articularis fibularis. Diaphysis of tibia has triangular shape and it has sharp anterior border, margo anterior, which is subdivides facies medialis and facies lateralis, and here it is posterior surface, facies posterior. Distal epiphysis has articular surface, facies articularis inferior. Here it is malleolus medialis, and this malleolus, medial ankle, has articular surface, facies articularis malleoli. This notch is incisura fibularis, place of attachment of fibula. It is left bone because malleolus medialis should be medially and tuberositas tibia looks forward, anteriorly. This tibia is right because malleolus medialis medially and tuberositas anteriorly. Clear? Right and left tibia. Next, fibula. Greek name of fibula is perone, that is why nervus peroneus, arteria peronea, musculus peroneus longus brevis, clear? You should know both Latin and Greek name, fibula and perone. Maybe this one, the same broken, but here it is head of fibula, caput fibula with apex capitis fibula, and malleolus lateralis, distal epiphysis, that is malleolus lateralis. It also has articular surface, facies articularis malleoli, and fossa malleolaris. This fossa is behind posteriorly from articular surface. Now I take it in my right hand, and this fossa malleolaris posteriorly. That is correct position. This surface looks medially. If I take in my left hand, surface looks medially, but fossa malleolaris were anteriorly. It is not correct. Only this is correct position. Clear? And here it is the same. Facies articularis malleoli medially and fossa malleolaris posteriorly. It is left, and here it is right fibula. Bones of the foot subdivides into bones of tarsus, metatarsus, and phalanges. Phalanges, the same like on the hand, we have proximal, middle, and distal. Distal phalanx has tuberositas. First toe has proximal and distal. Sometime little toe the same has two phalanx. Here it is three, but sometime distal and middle phalanx fuse together and forms one distal phalanx. Proximal in this case and distal in fifth toe. But it is only sometime in and usually three phalanges and two in first toe. Bones of tarsus. The same like bones of carpus, all of them are short spongy bones, and they make two rows. Do you remember how many bones in proximal row on the hand?
Four.
And four in distal row. Here it is two bones in proximal row and five bones, 1, 2, 3, 4, 5 in distal. That is why total number of bones 7. We start from first, that is Talius or Stalius. Here it is Talius, and this bone you should, together with calcaneus bone, these two bones in proximal row, you should identify is it right or left, the same. Talius consists of body, corpus tali, here it is body, and head, caput tali. Between them, neck, column tali. Upper part of the body has name Trochlea tali. Here it is Trochlea, and Trochlea has three articular surfaces. This one superior, facies articularis superior, and this surface is facies malleolaris, because both ankles, medial and lateral, attached to this surface. Look here, that is facies. No, it is wrong. Okay, here it is. This facies articularis malleoli, and this facies malleolaris lateralis. That is place of attachment of malleolus lateralis. Clear? Facies malleolaris lateralis and facies malleolaris medialis. Two processes. Here it is processus lateralis, and this one is processus posterior tali. And inferiorly we have groove of the talus, sulcus tali, and navicular articular surface on the head, facies articularis navicularis, because navicular bone, that is navicular bone, attached to this surface, facies articularis navicularis. If you want, only if you want, that is posterior process, and it subdivides into two tubercles with the help of groove. In your textbook, name of this groove is absent, but it is present in atlas. Only if you want, you can prepare name of this groove. Name of this groove is sulcus tendinis musculus flexoris hallucis longus. Yes. Very long name. Not so difficult, because sulcus, that is groove, tendinis, sulcus, tendinis, tendon, that is part of muscle, tendon of muscle. Sulcus tendinis, musculus, that is a muscle, musculus, flexoris, flexion of thumb, of big toe on the foot. Flexoris, hallucis, hallux, that is Latin name of thumb. Musculus flexoris, hallucis longus, long muscle which participate in flexion of thumb. Sulcus tendinis musculus flexoris hallucis longus. But it is not necessary. I will not put you mark, high mark if you prepare, but you will shock your parents. You will call and say, Mama, Daddy, only one small groove in Talius has so long name. Well, next, how to identify? You take that head of Talius looks forward and lateral process looks laterally. That is right Talius. It is the same. Look, that is right Talius. Lateral process, here it is, and head looks forward. Next, calcaneus bone, os calcaneus. It has support of talus, that is support, sustentaculum tali. Here it is tuber calcanei, and this tuber consists of two processes. Here it is processus lateralis, it's smaller, and processus medialis is bigger.
She said that she's not feeling well and she wants to lie down. So is it okay if we go to hospital?
Okay, not a problem. Okay. Bigger, that is processus medialis, and lesser, that is processus lateralis. And this surface is facies articularis cuboidea, cuboid surface, and it is sulcus calcaneae. Sulcus calcaneae. This bone is left, look here, that is left, and it is right. Because sustentaculum talis should be medially, and tuber calcaneae looks backward, that is left, and it is right, that is right. Clear? That is opposite bones. In whole foot, sulcus calcaneae and sulcus tali, when these bones join together, space between them, that is sinus, sinus tarsi, space between talus and calcaneus bone. Yes, you can. Next, cuboid bone, os cuboidum. That is in front from calcaneus, that is cuboid bone, os cuboidum. It has tuberositas cuboidea, and this groove you need to prepare, that is sulcus, tendinis, musculi, peronei longi. Peronei, that is fibularis. Musculi peronei longi. On inferior surface of cuboid bone. Name of this bone, tuberositas cuboidea, and groove of long peroneal muscle. Next, navicular bone. Navicular bone is look almost the same like which bone on the hand. Look here, only it is larger, like scaphoid bone. Yes, it looks like scaphoid bone, but it has specific name, navicular bone, os naviculare. And it is tuberositas of navicular bone, tuberositas ossis navicularis. And 3 cuneiform bones. I have only 2, not a problem. It is. That is navicular bone and 3 cuneiform bones. Os cuneiforme mediale, os cuneiforme laterale, and smallest os cuneiforme intermedia. Largest bone is medial, smallest intermediate, and middle size in lateral bone. Os cuneiforme mediale, laterale, and intermediate. Bones of metacarpals, the same like metatarsus, the same like bones of metacarpals. They are short tubular bones and they are monoepiphyseal. One true epiphysis at the base of metatarsal bone. It is head of metatarsal. We have tuberositas on the base of 5th metatarsal bone and tuberositas at the base of 1st metatarsal bone. All another the same like on the hand. Base, head, base, and tuberositas phalangis distalis. These 2 bones necessary to answer that is it right or left. All another only names. It is tuberositas, the same tuberositas and groove sulcus, tendinis, musculi, peronei longi. Any questions? Well, that is all.